Hello and welcome to the Probe Dental Podcast. Today we're joined by the Chief Executive of the British Dental Industry Association, Edmund Proffitt. Edmund, welcome to the podcast. How are you doing today?
Hi, James. I'm doing very well, thanks. And thanks for giving me this great opportunity to talk about what is a really interesting and quite important subject that often gets just a little bit overlooked.
Brilliant. Well, I wanted to start off with a bit of an introduction to yourself, because everybody watching, listening, not everybody will be aware of yourself and the BDIA, as the association is abbreviated. Could you give us a little bit of an overview to kick us off?
Yeah, absolutely. I'm Chief Executive of the BDIA. I've been in that role of over 9 years now and been involved in dentistry for about 15 years from previous careers working within trade associations and those sort of advocacy areas. And the British Dental Industry Association was established in 1923 and is the UK's dental industry trade association, representing and supporting the collective interests of manufacturers, suppliers, and distributors of dental products, services and technologies. We've got about 100 members, and we represent an industry worth about £1 billion and covering about 3,000 employees.
Excellent. So obviously we wanted to talk about device regulation. Obviously in the dental sector, regulation is so important. Obviously it's the health and safety of patients as well as practitioners. Could you talk to us a little bit about device regulation and your role in it?
Yeah, well, a medical device is basically an instrument or an apparatus or appliance that is used in relation to the diagnosis and treating of any diseases. And obviously, dentistry cannot be undertaken without dentists actually using tools or these devices. So absolutely critical to what dentists do in the provision of oral care. And these devices obviously are very specialist, and they are used on patients, so they are very tightly regulated. And over the last 10 or 15 years, even pre-Brexit, there's been a whole review and overhaul of the way in which devices are regulated and controlled and placed on the market. So we are in quite exciting times because some of the legislation is actually changing, which will benefit the UK market and give greater availability of quality devices from around the world. But the key issue is that these are devices that are used invasively and on the human body, so they have to ensure or meet very strict requirements and criteria to ensure that they are safe and continue to be safe. And so that's what medical device regulation is all about, really.
So obviously you mentioned Brexit. I was just wondering kind of how, that impacted things, because obviously, many products, outside of dentistry as well as in, obviously carried the CE mark before, and obviously I think still do, but we have the new UK one as well. I just kind of wondered, kind of whether you've seen much of an impact from that and where we now stand.
Yeah, that's a great question, James, and it's one I think where the dental industry and the association can blow its trumpet. Going back to the days of Brexit and post-Brexit, the government was extremely keen on implementing a whole new sovereign regulatory regime for the UK. So that's where the UKCA mark came from. And I remember going back to meetings 10 years ago, and the government was very keen on setting up a whole new regulatory system. And that would mean that companies producing and providing medical devices and dental equipment would probably have to go back to square one and get them all certified for use in the UK. And that would mean millions of pounds of additional expenditure and cost, inevitably, I guess, passed on to patients or to the dental industry and patients. So we've been lobbying very strongly, along with other organisations, over the last 8, 9, 10 years to look for a pragmatic solution. And we're delighted that over the last few years, we have effectively reached that solution whereby the EU CE mark will be recognised, hopefully, or will be recognised indefinitely as a route to the market in Great Britain. I won't say, of course, UK, because Northern Ireland is subject to the same rules as the EU. However, if we do move towards recognising the EU CE mark, that will alleviate some of the issues, I think, arising out of Northern Ireland too. So we're just coming to the end of a consultation with the government now, and the outcome of that should be the CE mark will be recognised as a pathway for sales of devices in GB. So that's, I think, very complicated, But it is good news. It is something that the industry can celebrate, and I hope it'll mean cost-effective, quality products are available to dentist colleagues all across the UK and GB.
Brilliant. I can't believe it's been almost a decade when you put it like that. It's
Frightening, isn't it?
But sorry, I interrupted you before as well. Just trying to remember where you're sort of.
Yeah, I think absolutely. Sorry, James. No, I think it's important just to put it in the EU perspective, as you said, and for those of us heavily involved, it is very much light at the end of the tunnel of what has been a struggle, and we are looking forward to these changes coming through later in the year. So, just looking at devices, the way devices are regulated is broadly based on their risk. Obviously, in dentistry, we have intraoral cameras and lights and prophy powder and things that are not a significant risk. And then we move up the hierarchy, where we have restorative materials and implants. And basically, all medical devices are split into 4 categories. Class 1, which is simple and in dentistry, such as intraoral cameras or hand instruments. Class 2A is things like dental restoratives, handpieces, treatment units, impression materials, the sort of things that we use very regularly. Class 2B is generally regarded as medium risk, and that includes implants, abutments, X-ray equipment. And Class 3 is very rarely seen in dentistry, and they're very high-risk devices, invasive devices, implantable devices, more so than just perhaps dental implants. They're like pacemakers and such like, and orthopedic devices. But it's quite interesting. Most of the products we use are medium risk. But if you, for instance, have a restorative that is releasing something like fluoride, that does fall into the highest category 3 certification, because it is a sort of a long-term implantable device. So when a device is put on the market, it is risk assessed, what class it's in, and then all the documentation, paperwork, quality management systems have to go to what's called an approved body in the UK or a notified body in Europe. These independent bodies scrutinise in great detail all aspects of the device and check your quality management system and check that there is a post-market surveillance system to pick up any subsequent issue. Once that is done, that's what's called a conformity assessment, and companies pay tens of thousands of pounds, hundreds of thousands of pounds or euros, depending on the complexity. And then the product can then be made available on the market. I must say, for Class 1 devices, for simple hand instruments and others, companies can self-declare, so that they can make it a statement that they have a post-market surveillance, they have a quality system, because the risk of that is seen as a little lower. It's a slightly easier registration process. So once you've been through all that complicated business, you can register your device for sale on the market with the Medicines and Healthcare Regulatory Agency, and that gives you market access. And I think, James, that came into one of the other things we were discussing before this. And who regulates dental devices and instruments? Who are the police? That will be the Medicines and Healthcare Regulatory Agency, and they run a register. So all products that are sold in Great Britain need to be registered, and that register is public. And we'll come on to that a little bit later when we talk about non-compliant and counterfeit devices. So basically, yes, the MHRA ensure that everything is registered and safe for usage. And as we said, they are the regulator and the policeman.
So how do you sort of the BDIA kind of fit in as well? Because I know I've seen products that are BDIA kind of have the stamp of approval on from yourself. How does that all work?
Well, we don't sort of operate an approval system. As the BDIA, we do ensure that any members of ours, we do check that their products are on the MHRA database, and that they sign a declaration saying that they are complying with all relevant UK legislation. So they are checked out from that perspective. We don't run an independent sort of certification mechanism as BDIA, but we do check regularly on the relevant databases to see if products are actually there. But where we are engaged, James, and you've probably seen us and know about us a little bit, is in the work we've been doing for the past 10 or 12 years to try and address counterfeit and non-compliant dental products. And if I may, I just sort of go on to talk a little bit about that and the dangers that we have. For many years now, there's been a growing problem with counterfeit and non-compliant dental devices coming on the market. Now, we don't want to alarm anybody that might be watching this, because the vast majority of all the products on the market used by dentists are compliant and fit in with all the regulatory requirements. But certainly we have come across, and there's growing evidence of a number of products which are either personally imported by dentists, which are sold on non-UK websites, and that they just do not meet the requirements of the UK. So they might not have a full CE mark, or that CE mark might not be for the properties of a medical device. It might mean that they meet the low voltage regulations. So they have a CE stamp, but it's not actually relating specifically to their use as a device. And unfortunately, there are manufacturers and suppliers out there who, just as companies sell the fake Manchester United, Arsenal, or whatever tops, and the fake sunglasses and the Gucci's, this does translate, unfortunately, through to medical devices. And that obviously represents a great danger to the patient and obviously to the clinician utilizing these products. If you're working on in a patient's mouth doing a restoration, and you've got a handpiece that's rotating at tens of thousands, hundreds of thousands of RPM, there's a lot of energy in this, and if the device is not compliant and substandard in its manufacture, it has, and they have sort of exploded in patients' mouths, causing some significant difficulties. And it's not just the handpieces. We see curing lights, burrs, endo files, even X-ray devices have been seized by the MHRA for being counterfeit or non-compliant. So there is a significant hidden danger out there. So really, what we can't take on these manufacturers globally, but what we can do and have been doing for past several years is reaching out to the dental profession and just trying to educate what the requirements are as towards knowledge and procurement, but also educating as to the dangers, what can actually happen if you do use counterfeit medical devices. In fairness, using a counterfeit device and purchasing and using is actually a breach of the medical devices regulations and is a criminal offence. And we also point out, I think, to clinicians that under, I think it's standard 1.91, I know standards have just been changed recently, but basically registered dental professionals have an obligation to identify and follow and obey all relevant regulations that affect the practicing of dentistry. And I know for dental professionals, that can be anything, if they're a practice owner, to fire regulations, to everything. But of course, the regulations that govern the materials that they actually use on their patients, again, it is very best if these are adhered to and bona fide and quality products are used.
I was just wondering, is there anything that clinicians can do to, I guess, kind of make sure? Because I imagine some of the counterfeits, I mean, do they look like they might be compliant or the real deal, or are there any kind of signs?
Yeah, it is a bit of a minefield out there. So it's very difficult. There are fundamental things that can be done to ensure that products are safe, but it's not quite it's not as simple as just checking a CE mark. As a CE mark or a UKCA mark, which are not used that frequently, they can be stamped on or forged or whatever. So there's two real areas here. One is that, well, three, I guess, in fairness. One is to have a look at purchasing protocols. So whoever is responsible, in the practice for purchasing, whether it's to be a bigger group purchasing managers or the principal or whoever, the practice manager, there are a few questions that can be asked. And is there awareness of regulatory requirements and their importance within the practice and amongst users? Is it part of staff training, and is this communicated across the team? Can staff demonstrate where products were purchased from? What processes are in place for supplier selection? What checks are carried out before a product is purchased? And what processes are in place for addressing any concerns? So obviously, if you go on eBay or Alibaba and buy an NSK lookalike, NSK, WH, all our colleagues we work with, then buy a lookalike for 35 quid, as opposed to a handpiece which had cost many hundreds of pounds. It's obvious maybe that you're not buying what you are expecting to buy. So, it's all about, there are many credible and excellent websites around, but there are many not. And it's a question of using some common sense and running some checks. It's always relevant. I would recommend, in most cases, looking at purchasing, if you are going to use the internet, use UK registered sites. And, I would say use a BDIA member. There are many organisations out there. And if you've got any doubts, go on the MHRA website, something called the PARD, PARD, public database, and that's been upgraded and updated recently. So you can actually type in the device that you're buying, the manufacturer, and you can see if they're registered. And that, is a great tick box just to abrogate any responsibilities under the regulations. And, just actually looking at these things, as you mentioned, James, as in all counterfeits, it's look and feel. If you've got a product, particularly again a handpiece or a hand instrument, or generally if the printing on it is not super high definition, if there's any engraving or engine or indications, or indentations or engineering marks, and they're a little bit, that's looks a bit dodgy. That's a really good sign that it's and if it doesn't feel right, if it doesn't have that sort of weight and hand feel. These are very good ways of telling. Obviously, throughout the clinical progress and career development, dentists will become more and more familiar with the product they like and use. But any sort of alarm bells over, if they get it, if they've got a product that they are concerned about. And as I say, one of the slogans we've used, if it's too good to be true, it probably is. Don't risk handling counterfeit goods. It's so. I would say a lot of it is common sense, based on that with procedure, and if in doubt, check and ask and look. The BDIA has just launched some tools that anybody can have a look at on our public-facing British Dental Industry Association, so bdia.org website. And if you have a look at some of our regulatory FAQs, we have got a short little video explaining all about what regulation is, much more succinct than my talking today. And we've got some FAQs. And the FAQs answer some of the major questions any clinicians might have, any users. One is, how can I sort of spot the difference? Secondly, we're looking at some critical issues, which are, there's been a growing trend in colleagues maybe going on holiday and finding some products. A lot of dental products are high value and quite small. You might be able to find them overseas. You might buy them. They might even be quite legitimate, but if you cannot import, you have to be a registered importer to bring these products in. You can't just stick it in your suitcase. So there are issues about self-importation. Again, there's advice on buying, and there's also information on chairside manufacturing, because slightly different to what we're talking about, but under the regulations, if you've got digital chairside manufacturing, happening in a dental practice, that has to be, or you have to be registered as a manufacturer with the MHRA, because you're making custom-made devices, and they are taught under the same regulations as we've discussed, the medical devices regulations in the UK. And again, look for the CE mark, and you can always check. There is a European database. You can check issues that CE mark. So hopefully there's a few pointers there.
No, brilliant. We'll make sure to include the link as well in the episode description for the
absolutely
for your website and from the FAQs, the bdia.org. Brilliant. I mean, just to sort of go back through, I think kind of you've answered a lot of the questions I already had, which is great. Are there kind of any other issues or kind of non-compliance factors that clinicians should look out for?
Yeah, I mean, I would just urge clinicians and those involved in purchasing to be cautious. We have an extremely vibrant, competitive supply chain in the dental sector in the UK, and I think we can be hugely proud of that. We're, as British Dental Industry Association, we're very proud of the quality and the services provided by our members. And BDIA members, I would hope, are always the first to go to, but again, there are other suppliers out there who are equally meeting all the requirements. So yeah, just a little bit of common sense in what you're purchasing. Try and avoid eBay purchases where your senses are tingling a little bit. All majority of suppliers have excellent websites. They're quite, you can easily tell they are legitimate and belonging to that company. So, just exercise a little bit of caution. It will be good if there's, you can just tick a few boxes in terms of spoken to your staff about this danger. Just be sensible and careful when you're purchasing, and then everybody remains safe. This is all about patient and staff safety. So it's using a bit of common sense, taking heed of the advertising we put out in the dental press about these dangers, having a look at the website, and hopefully we can certainly continue to address this issue. And again, just reassuring everybody, this is not a massive problem, but it's quite significant. And of course, utilization of any counterfeit or non-compliant products, can impact on registration. It can impact on, insurance and dental defense activities, and it is a criminal offense. So stick to the rules, and everybody should be fine and safe.
Well, I can think of no better note to end on there, Edmund, but thank you for joining us today and for explaining all of this. I must admit I had no idea about some of the criminal implications as well there for kind of using a handpiece that perhaps or another device that hadn't been regulated. So thank you for sharing that. And yeah, just I say before we let you go, obviously we've already got the website, but is there anywhere else that our viewers and listeners can find you and find out more about the BDIA?
Yeah, absolutely. Probably the best one-stop shop is the www.bdia.org. And I say also the PARD, the MHRA's database, which has all regulated products registered with the MHRA available. That's a great one-stop shop. And you can also use something called Yellow Card, which is an MHRA website. Just Google Yellow Card, and you can you can report any concerns, confidential concerns, or reporting of any counterfeit devices you've come across or you think might be being used.
Brilliant. Well, thank you so much once again for joining us, Edmund. It's been an absolute pleasure.
Excellent.